tonight we have five wonderful speakers here with us. Dr. Brian Stedman. He is the Vice President, CMC Operations at Ligasite Pharmaceuticals. Jim Jacobs, Montana and Wyoming Plant Material Specialist at the Natural Resource Conservation Services. Katie Rouse, she's a Research Associate, Immunology and Infectious Disease at MSU. She's also a graduate of the program here at MSU. And because we don't have any faculty here tonight, they're all under the weather, she might be our person to ask questions for about the specifics of the program. Kathy Wojcik, did I say that right? Thank you. Director of Laboratory Operations at Bioscience Laboratories. And then on the phone, hopefully he's still there and I haven't disconnected him, is Dr. Marshall Bloom.
Hi.
And thank you. He's from Rocky Mountain Laboratories, Senior Investigator, Associate Director for Science Management. And that other thing that I can't probably pronounce all that stuff. But what I'm told also is that he's very key and works in hiring brand new scientists and interns. He is a very good resource for us as well. So thank you all for coming on up. And you can introduce yourself, tell us about your majors, your careers, your career path, what you do, tell us about your organization.
You want to sit, please?
Yeah, come on up.
Can you start?
Yeah, go ahead.
Okay, so I'm Brian Stedman. I'm Vice President for CMC Operations. Since nobody in this room knows what CMC stands for, it's Chemistry, Manufacturing, and Controls. Basically, within the pharmaceutical industry, that's how you make a product, how you control the product, and then ensure that it is both safe and efficacious when it reaches the market. Ligasite is a pharmaceutical startup company that has one product. We are working on a vaccine for norovirus. You may have recently heard that norovirus was detected on 3 cruise ships in Florida. It's also considered the most common acquired infection in hospitals, so that people who go to hospitals and have wings get shut down due to diarrhea and vomiting, it's typically a norovirus infection. So just to give you an idea of where I came from, I will back up roughly 20 years. I refuse to use the word old. So about 20 years ago, I graduated from high school. I was an athlete, and my choice of college was who's going to give me a full ride. So I went to the University of Wyoming to compete in track and field. And along the way, I discovered I had to have a major, so I took microbiology. Graduated with a BS degree in microbiology in 1979. Had gotten married by that time. My wife had a great job, so I thought, going to school's not bad. I'll get another degree. So I then moved into toxicology, which is in the zoology department. Got a PhD in toxicology. Now it was time to get a job, and so we liked Wyoming. I stayed there, broke all the rules, had a postdoc and faculty position in the biochemistry department then, doing biophysical chemistry. Well, that took me about 1986, and that was time to get a real job. We were having kids, and my wife said, she's not working now. So I moved to the Columbia National Contaminant Research Center, where I was the section leader for biochemistry, physiology, and histopathology. Along the way, Genentech was formed, and they had their first approval in about 85, 86 of a growth hormone. Eli Lilly had had insulin, and Merck decided they wanted to start biotechnology. So, well, a friend of mine actually knew I existed. He found out, wait a minute, this guy has microbiology. He knows how to work with sterile things. He has toxicology. He understands how molecules impact an individual. And he has biophysical chemistry, so he knows how to study how these proteins or products degrade or are damaged during storage. So it was a perfect match, and Merck then recruited me and convinced me to move to Philadelphia. 5 years later, I moved to Bristol-Myers Squibb, where I took on a new role as a Senior Director of Bioprocess Development, and then moved within the company to Senior Director of Strategic Planning. Every 5 years I get bored, so another 5 years passed. Chantel mentioned your career is not stagnant. From Bristol-Myers Squibb, I got a phone call from a headhunter saying there's a company called Allergan in Irvine, California. They have a a little product that they're trying to figure out what to do and how to make it. I knew that product because it was the most toxic biological molecule known. You all know the product as Botox. So I worked on the manufacturing process then for Botox. Spent again roughly 5 years there. I knew Chuck Richardson, who was vice president of R&D at Ligosite, and I knew Rob Bergazzi, who was the founder of the company. I said, it's time to start a development company. And they said, yes, we want to get into the clinic. That was 5 years ago, and we've had 4 INDs since that time for a product, one of which is now moving along into phase 2 clinical trials. So that's the short story.
I'm Jim Jacobs. I'm plant material specialist, Montana, Wyoming, with the Natural Resources Conservation Service. And we're right downtown at the federal building. And yeah, when I was a kid, I just wanted to work outside. That was, kind of, I didn't want to be stuck in an office or anything like that. So I got into biology, I thought, with the aim of getting into forestry. And so I went to School of Good Biology at North University and got a Bachelor's of Science. And during the summers, I would, that was in Appleton, Wisconsin. In the summers, I would come out here to Montana and work as a mule packer in the Bob Marshall Wilderness. And which is how I got to Montana. So when I was done with college in 1978, I moved out here and had a number of jobs. The mule packing job, of course, didn't last too long. And I worked for the State Department of Lands on a tree thinning crew, a backup fire crew. And after doing that for a while, I decided to go back to school and get advanced degrees. So I did that. Got 2 advanced degrees here at Montana State University. And during that time, I had jobs working in the biology department, which of course paid my fees and paid me a little bit of salary. And in the summers, I would bid on thinning contracts with Gallen National Forest. And then I also did the sensitive plant survey for them. So my biology was mainly botany and ecology. And one of the things I did while I was here was teach the plant ID lab. So that really came in handy as far as landing the sensitive plant survey job. You can't ask for a better job than that. Mule packing, sensitive plant survey, wandering around the forest, keying out plants. They were all great jobs. And then, of course, after getting my advanced degrees, the pressure was on to get a real job. So I ended up working here at Montana State University. I got a postdoc here, and then I was a research professor for a number of years in Roger Shealy's lab at Land Resources and Environmental Sciences, developing integrated management of noxious weeds. And the tough part about that job was it was soft money, so I had to write grants. That's tough because you got to write a lot of grants to get enough money to support yourself, to get a few funded. So about 6 years ago, when Dave White was the state conservationist for the NRCS here, one of his big things was noxious weeds. That was one of his big resource concerns, was noxious weeds. So he opened up a position for an invasive species specialist, and so I applied for that and got that, and that's how I got in with the NRCS. And then the plant material specialist retired, so I also became the plant material specialist and invasive species specialist, which is kind of how it works in these types of situations. And so that's where I am now. And plant materials are, you all know what noxious weeds are and invasive species. Plant materials are good guys out there. So it kind of fits together, the weeds and the plant materials. So when the NRCS, what the NRCS does is it helps farmers and ranchers put conservation practices on the ground. So to keep the soil on the ground, keep it from eroding, improve water quality, wildlife habitat, production, all those things are important to NRCS. And so we help farmers and ranchers do that. So if they want to increase their forage production, they use grasses, which are plant materials. So those grasses have been developed through plant material programs, either with the ARS NRCS or even the private industry develops plant materials. And so that's a lot of what I do. Collect wildland seed. I work with the Plant Materials Center, the scientists at the Plant Materials Center in Bridger, and that's where we do all the testing and selecting. And then once something meets all our requirements, it is released to the commercial seed industry, and you can buy it and use it to improve your pasture or reclaim your disturbance. That thing.
Hi, I'm Katie Rouse. I actually graduated from the biotech program here at MSU in 2004. When I was deciding what I wanted to do for college, I was really thinking pre-vet, and then I came here and I decided that pre-vet wasn't for me, but I had gotten turned on to the biotech program, which was relatively new at the time. So I took Intro to Biotech, which I don't know if they still do that course or not, but it was a semester-long class where they had a whole bunch of different professors from the university and people from Legasite and other companies, bioscience labs, come in and do, so every single class was a different person telling you about a career in biotechnology. And so that was my first semester, and I intentionally chosen this career path, and I thought it was awesome. So I continued on, and I actually, it's an interdisciplinary course, so you start out your first 2 years as a general biotech major, and then you specialize either in animal systems, which is through immunology and infectious disease, or plants, which is through, I think that's in the College of Ag still, I believe, and microbiology, which is through College of Letters and Sciences. So I went the animal systems option route, and it's a great program. It was very hands-on. I learned a lot of techniques that I use in my job today, and definitely made me a way better candidate for grad school than a lot of other people, because I actually got to run a flow cytometer, and I got to do ELISAs, and I made hybridoma cells, which might sound like gibberish to all you guys, but in the world of biotechnology, those are big things. So I learned a lot of assays and techniques and actually got to do them that you don't get to do at a lot of places, especially use a flow cytometer. We were talking about a $60,000 machine. Normally they don't let undergrads in within a 10-foot radius of those things. You know, they're like, stay away, we don't want you near this, very expensive. I got to play all I wanted. And so that was really great for me because it was great to be able to put on my resume all these practical applications. When I was in my senior year, I was debating, did I want to go to grad school right away? Did I want to get a job? I wasn't sure. I was wish-washing, you know. I just had 4 years of really intensive school, and I wasn't sure if I really wanted to keep doing school or if I wanted to take a break for a little while. And the decision actually got made for me because I applied to one graduate school and I didn't get accepted. And so I was like, well, okay, then I'm going to work for a while. So at that point in time, it was graduation, and I hadn't really gone to the Career Center, which I should have done. And I hadn't really done any much career fair stuff or anything, because my plan was kind of to go to grad school. And so I don't know if any of you guys are seniors, but sometimes you get to that point, you're like, I don't know what I want to do. So I actually had exit interviews with the department head at the time in our department. We were actually vet molecular biology back then, and he kind of prompted all of us in the program to leave our resume with the department, because they know how we get trained over there, and they know that we get trained really well, and we get trained in a lot of techniques that they all use. And so they're really willing to hire you because they've seen you in classes and they know that you know your stuff. So I was getting my resume ready for other places and getting ready to send some stuff out. I was getting ready to send one to bioscience labs and looking around the area because I love Montana and I love Bozeman. And so then I got a phone call, and it was actually my department head's lab manager who called me and said, hey, we're losing 2 of our technicians. we'd really love to have you come in for an interview. And so the rest is history. I got the job. I worked there for 2 years doing pulmonary infectious disease research, so like pneumonias and influenzas, diseases that affect the lungs. And then I decided, I think I really want to further my education. So I applied to go to grad school, and I ended up going to Washington State University for my master's. And I got my master's there in genetics and cell biology. And I actually originally applied for a Master's of Biotech program, which was a 1-year class intensive with an internship with a biotech company program. And I came there to kind of see the school and just visit and talk to people about the program. And the professor in charge of like recruitment and new graduate students in the molecular biosciences school sat down with me and said, I don't think this is the right program for you. You have an excellent class, like your degree program is amazing, your letters of reference are amazing, your work history is amazing. We really just want to hand you this offer letter to be in our Master's of Science program, a thesis major, and we'll pay for all your school and we'll pay you a stipend. So, decision made, and I said, you want to pay for my school and give me, money to live on, I am so coming here. So, I mean, because it's a lot of money to go to grad school. So, but really, honestly, they said the coursework I had in my degree program, and my boss obviously wrote me a reference letter, and he was no longer the department head at that time. He's just a professor in the department now. But I also had reference letters from 2 other professors in the department who had seen me as an undergraduate and had worked with me. And the biotech program here at MSU isn't super big. And so whatever your discipline that you go into, you have really small classes by your junior and senior years. I think I had 12 kids in my graduating class from my discipline, and that was one of the biggest classes that we've had. So, I mean, you're getting a lot of hands-on and face-to-face time. And so they had seen me through that, and they knew me well enough through that they also wrote me really great letters of reference. So I graduated in 2008, which was a really crappy time to graduate, and I was unemployed for like 9 months because the economy crashed. I mean, all these businesses were laying people off. I was vying for jobs with people who had, 10 years of experience and stuff like that. So it was kind of not so awesome of a time, but my connections came through for me. I kept in the loop. I actually visited the Career Center at WSU and went to career fairs and stuff, and actually ended up, because I stayed in contact with my department here as well, because it was always an option for me to come back. And I re-sent a resume to the department head and to my old boss, and I just said, hey, if anyone in the department's hiring, if you could give me a heads up, that would be awesome. And lo and behold, my old boss actually called me up because he got an R01 5-year grant and said, hey, are you still looking for a full-time job? And I was like, yes, sir, I am. And so up to that point in time, I'd actually done some teaching as well. So I have a master's, which allows you to teach at a lot of community colleges. So I was adjunct teaching at Spokane Community College in Spokane, and it was awesome. I loved teaching. It was really great. So that is also a career option in the future. And I had actually kind of arranged some stuff to do some teaching at ITT Technical Institute as well, after I was done with my SCC stuff, because they were going to start moving into like nursing programs and stuff there. So I was unemployed, but I wasn't completely unemployed during that time. I did have some adjunct work and stuff. So there's just all sorts of different things you can do with your career as a biotech major. I mean, you can go into industry. You could get your PhD and you could become the PI of a lab. You could, work in a lab as a technician. You could become a teacher if you get your master's or your PhD. And it's a really great program. I enjoyed it thoroughly when I was here. And so I'm back here. I'm working on pulmonary infectious disease research again. We have a collaborative project with Trevor Douglas's lab in the biochem department, and he makes us these really awesome protein cage nanoparticles and virus-like particles that we put in mice, and they cause the mice to not get as sick when they get the flu or when they get methicillin-resistant staph aureus pneumonial infections, which is a big one because MRSA is probably how you guys, MRSA, know about it, but it's rampant in hospitals. And if you go in with, say, the flu and you're sick and then you get MRSA as a pneumonia, it's really bad. You're pretty much a goner. So we've come up with all these really great things that we're actually trying to work on getting into a place where we can then move into clinical trials. So it's really, really interesting and exciting work that I do. And I mean, it's just awesome. I really enjoy it. So.
Hi, I'm Kathy Wojcik, and as Chantel's already told you, I'm the Director of Laboratory Operations at Bioscience Labs. Bioscience has been in Bozeman for 20 years. It's a privately held enterprise. We do, seems like the clinical trial docket up here. So we do phase 1 clinical trials, mostly focused on the antimicrobial and disinfectant markets. So while Brian's sitting over there making a vaccine for norovirus, we are testing products against norovirus to determine whether or not those products are both safe and effective for killing those noroviruses. Our laboratories, we actually have 3 laboratories. You could say maybe 4, but we'll stick to 3. We have a virology laboratory that does not use viruses, and we have a host of viruses, probably 3-4 dozen viruses that we use every day, and we maintain our own cell cultures. And so we have a PhD leading that particular laboratory, and technicians that assist. Now, unlike in other places, we have PIs, or what we call a study director. So they are responsible for the oversight of an entire clinical study. Underneath them, developing into study directors, are what we call associate study directors. There's a ton of paperwork when you're doing a clinical trial. I cannot even tell you. A final report, seriously, depending upon the nature of the study, could be 400 to 500 pages long. Data, 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 signatures and dates on everything. Full traceability. So we have a virology lab that is doing clinical trials. We have an in vitro lab, which you might think of as bacteriology and microbiology. So a whole host of bugs that we maintain, some of which are frozen that we rehydrate, some of which we actually maintain, and test a variety of products to see if we can kill these bugs. And then we have our clinical lab. Have any of you ever participated in a bioscience study? All right, yeah, there's usually a few. It is amazing. We are continually looking for volunteers for our studies. We mostly do things that are, again, if anybody's ever used Purell, we are the laboratory that help the makers of Purell put Purell on the market. So that's, you know, you don't see our products, you see the activity that comes out of those products. So you name any big manufacturer of any type of soap or disinfectant, not only for the consumer market, but more focused on the healthcare market. Think about the liability in a hospital when surgeons are scrubbing. What about antimicrobial gloves, where the inside of the glove is actually coated with something antimicrobial to actually protect the doctor? We're not thinking about the patient now. Surgical scrubs. If any of you have ever had surgery, you know, they have to make you all nice and messy before they do their first cut. Well, how do you know that that stuff really works? That's the kind of stuff that we test. So we are always looking for people to participate. We employ about 60 people in our laboratories. We will be growing to 80. If you drive out on KD now and get to 19th, you'll see 2 big buildings going up. That would be our new laboratory and our new administrative building. So, and Chantel mentioned the career fair. We will indeed be here for the career fair. A lot of our people are very much like what Katie was saying. They come to us, they come right out of college, they're not really sure what they want to do. They do a couple of years with us doing clinical trials, and it really beefs up their resume. We've had, in the last year, We've had a person go on to med school, a person go on to PA school, one go to med tech school, one went to a medical mission in Nepal. So we've continually gotten a lot of churn, and we expect that. We want that, okay? So if you're looking for a job and you have a window, we're perfectly fine with that. For myself, I'm a biology major. Really thought I would want to do medical school. Glad I didn't. Had an opportunity to go med tech. Did that. Worked in a hospital for a lot of years, probably 5 or 6 coming right out of school. So I didn't have all the fun things that these guys are talking about where they got a chance to really play. Went to work immediately. And then found an ad came through for Corning in their medical device division. And overnight, after I got that job, I went from a consumer using their products to a person who was helping them manufacture and test their products, literally overnight. But it was a great parlay for me because manufacturing in the medical device market was fascinating, far more fascinating than anything that went on in a hospital, believe me, for me. So I did this clinical work, transitioned into medical device, and then went into pharmaceuticals. And have worked for big name pharmaceutical companies that you would know, like Pfizer, and have had a very blessed career. Started out in quality, worked regulatory affairs, went into production, went into operations, then did a stint in HR, and in the last, I would say, 10 years have kind of varied my time between training and leadership development and operations. So that's kind of how I balance right now. And when Chantel called me, she said, could you bring the perspective of the hiring manager? And that is something I've probably, in my career, I've probably hired, I was thinking the other day, probably more than 3,700 people in my career. Loads of people, huge swaths at a time. So if you've got questions when we get to that about what to do with your resume or what we are looking for at Bioscience or some recommendations, I'd be happy to field those questions. I would like to just state one other thing. There is a huge difference, if you get an opportunity to work in research, there is a huge difference between what is done in research and working for a for-profit institution like Bioscience. In research, oftentimes you're given the privilege of following the data and discovering where it takes you. At Bioscience, we have an end point. We have a customer that we must serve. They've come to us with a problem. They want to prove, is this effective? And that is what we do. So oftentimes when I'm interviewing people, people come in thinking they're going to do research. And we are not a research institution. Do we do R&D? You betcha, all right? But it is to support and be a foundational piece to our for-profit type of work.
Hey, Dr. Bloom, are you still there?
Yes, ma'am.
Okay, why don't you tell us about yourself and Rocky Mountain Labs?
Okay, well, thanks, Chantel. I'm really sorry I can't be there in person, but my schedule didn't allow it. So I am the old person. I graduated from college in 1967. I went to medical school at Washington University in St. Louis and was a pediatrician there for 1 year. During that time, I became interested in chronic or persistent virus infections and was lucky enough to land a job at the Rocky Mountain Laboratories here in Hamilton, Montana. The Rocky Mountain Lab is part of the National Institute of Allergy and Infectious Diseases. We currently have a total staff of about 450 some odd people. We have 17 principal investigators, a half a dozen tenure track investigators, 73 postdoctoral fellows, and then about 100 graduate students, technicians, post-baccalaureate students, and things like that. That's our scientific team here. I'm the Associate Director for Science Management, and in that position, I either supervise or facilitate most of those research programs. As I noted, we do have a fair number of students and postdoctoral fellows. We have had in the past students and postdocs from Montana State. We have a couple of technicians over here who are graduates of Montana State, and a couple of faculty members over there, too, that I can think of, Ivanka Voyich and Rich Basson, were actually studied here at Rocky Mountain Labs before coming to Montana State University. As I said, I got here to Montana in, well, I didn't specifically say it, but I got here to Montana in 1972, and I've studied chronic virus infections throughout the course of my career. My research program now is currently on viruses which are carried by ticks. The other research programs that we have here are almost every serious viral or bacterial infection you could think of. We have everything from MRSA to Ebola virus, Lassa fever virus, pestis, Yersinia pestis, bubonic plague, tularemia, let's see, salmonella, everything you wouldn't want to catch, that's for sure. I know that you're getting some great career advice from the folks, but let me just, in a minute or so left to me, tell you that the NIH, of which we are a part, and Rocky Mountain Labs do have programs for students at a variety of points in their career. We have summer interns who are usually university students. We used to have as many as 30 or 40 of those a summer, but since Congress has cut the NIH budget so bad, we now only take about a half a dozen. We have opportunities for postbacks. These are students who want to go on to graduate school or medical school, but want to spend a year or two doing research. We typically have about 4 or 5 of those here at a time. We have a few actual graduate students from a variety of institutions. And then we have, as I mentioned, a relatively large number of postdoctoral fellows who are people who have gotten their PhD or in some cases an MD degree. You can learn about those various positions, although the number that we have here available at Rocky Mountain Labs is fairly limited, by going to the NIH website, which is so the education and training part of that website is www.training.nih.gov. And if you'd like more information about that, and you can get my contact information from Chantel, and feel free to send me an email, and I'd be happy to answer any questions for you. And I think with that, I want to make sure that you have adequate time, Chantel, for questions from the attendees, so I think I'll stop.
Okay, thank you. With that, I think we'll just open it up to the audience, and please ask as many questions. We've got some great minds up here and good connections for you guys, so ask some questions, find out what you need to know.
When you guys will take undergrads as either employ them or put them as like an internship or like for undergraduate research?
Absolutely.
Yeah.
Every PI in our department will take on undergrad researchers for internships, and or even if so for the biotech program specifically, I know you have to do an internship to graduate. That's part of it, and I'm not sure about other degree programs on campus. I'm sure quite a few of them are doing that now. So they'll do that, but also if you're just really interested in getting in and doing some research to see if you like it, yeah, I mean, pretty much the best way to go about it is to contact our department head, who's Mark Cohen, and just say, I'm interested in doing an internship, and then, checking out the different PIs in our department. If you just go on the MSU website under immunology and infectious disease, it shows each lab and what they research, and gives a little synopsis of the research of each lab. And then actually contacting the PIs themselves by email and just saying, hey, I'm really interested in your research. I would love to get into it. I'm an undergrad. Do you have anything available? Sometimes it might be paid, sometimes it might not be. I'd say in our department it tends to be paid more often than not. But yeah, I mean, it's a good thing because I applied for grad school to begin with to do reproductive physiology, and then I went to work in an immunology and infectious disease lab, and I was like, screw that. I don't want to do that. This research is amazing. I'm so glad that I worked for 2 years instead of going straight to grad school because that's what my career path has been. So I really recommend if you're thinking of going some way with your career to definitely try to do an internship or try it out first, because you might do it and decide that it's awful and you hate it. I did undergraduate research through the undergraduate scholars program for 8 months doing bioinformatics research, and it was awful. I did not like it at all. I mean, but somebody might love it, you know? So it's just definitely the best way to do it is get them in contact with the department head, and then any individual PI that you think their research looks like something you'd be interested in getting a hold of them too.
The NRCS has what they call the SCIP program, which is an acronym for something I can't remember what it is. And it's an internship program. You can probably find out about that at the career fair. I'm pretty sure NRCS will have a booth at the career fair, or you can contact our human resources department and find out about the SCIP program. But usually it's during the summer. It's a summer internship, and you will work in one of the field offices, and so you'll be working with doing the same thing people in the field office are doing, and then you also get to move around the state and try a few different things. So it's a pretty good program.
Okay, we have relatively few interns. Our work tends to be highly documented and very controlled, but I can tell you that getting an internship completed is almost essential to getting a job, because your resume will come in, but the first thing I'm going to look for is experience. One time I did a search on monster.com to look for pharmaceutical researchers and look for the word with experience, and 90% of the ads that I found all had with experience. So you have to do something to differentiate yourself as a student beyond just doing the coursework. You really got to find that internship, that opportunity, and then have an idea of how you can apply yourself to help to benefit the company. Our head of HR is here, Doug. And we do off and on have internships, but they're just not very frequent.
And so we're kind of right on that side of the table because we're a good balance. So we hire undergrads all the time. I'd like to echo his sentiments about internships. Occasionally we might have something that would be internshipable, but not typically. But we do hire undergrads. We've actually worked with students on a part-time basis. It is heavily documented, but we do not necessarily look for experience. It's nice if you bring it, and I would agree with Brian, if you have it, you should leverage it. It should show up in your cover letter, it should show up in your resume, and you should be able to talk about it easily on a phone interview and in person. If you can't sell what you've got, I'm not going to be buying.
One more thing I forgot to mention, if you are interested in plant materials, the Foundation Seed program here on campus, since we're a government organization, we can't sell the seed that we grow at the Plant Materials Center, so the university here in Montana, Wyoming, sells the seed to seed growers. And the money that goes in there helps fund either a graduate student or an intern. So every summer we usually have an intern at the Plant Materials Center in Bridger. Usually from Montana State University.
Dr. Bloom, you were mentioning internships with Rocky Mountain Labs. Can you tell us more about that opportunity?
Right. Well, as I said, we presently only able to take about between 7 and 10 summer interns a year. We get about 300 or 400 applicants from all over the country, so the competition is pretty stiff. I would really kind of echo what the other folks have said. Experience is good. Experience is good, but it's not critical. I mean, frankly, all of our successful candidates have GPAs of between 3.8 and 4.0. ones we get, they all have great grades, they all have good letters of reference. So one of the things that stand out, your cover letter and your letter of interest are things which are really, really important. And I mean, that's really the first thing that I look at, and I've probably had, I don't know, probably 30 students over the course of the year, a number from Carroll, some from MSU and UM and other places. I want to say that although this is a biotechnology information session, I think one of the most important things that you as undergraduates can do is become very skilled in English composition. It's one of the first things that I look at when I look at letters of interest and emails for people looking, everything from like high school kids to people looking for postdoctoral fellows. If someone is really a good writer, can put together logical sentences and paragraphs and a convincing case, I think that's a major thing. And I think it's absolutely critical. If you can't communicate what you're doing in science, be it basic research like we do or applied research like is done at Legasite and some of the other places over there, you're going to be at a serious disadvantage.
Thank you, good point. Other questions?
That's my story and I'm sticking to it.
I was just going to mention we do have a career coach here, Nancy, and she does know about the STEP program. If you go on the website makingthedifference.org, it will explain all about the STEP program on there. And she's also can tell you that she has helped many people with writing their resumes and their cover letters and putting your thoughts together and having them look very stand out from the rest.
Yeah, I've heard some people say that cover letters are outdated with all the computer screening, but don't believe it. When I was at Merck or Bristol, I would get hundreds of resumes for every position. Somebody had already screened them to see were there keywords in there. And the first thing I'd do is just read the cover letter from the short list that got through to that. And if the cover letter didn't catch my eye, I didn't even look at the resume. So it's really important to market yourself in that cover letter, both how the position can benefit you, but also how you can benefit the company or group that you are applying to.
I would fully agree with that, and I mean, standing out, think about how you want to stand out. I have seen resumes and cover letters on purple paper, scented paper. This is not the way you want to distinguish yourself from a scientific organization, I can assure you. I think Brian brings up another good point. For God's sake, spell check it and read it backwards. There are people in my organization who take that very seriously. We write literally thousands of pages of final reports and scientific documents, and spelling is important, and you can distinguish yourself by, as Brian said, putting a couple of sentences together that actually read well.
Well, and the Career Center is excellent for that stuff, and also mock interviews. When your presence in a phone or in a personal interview, I mean, you've made the even shorter list of the cover letters and resumes that we like, but I mean, if you come in an interview and you just can't sound put together and like you know what you're talking about, and you understand what you did in your internship or your previous job or all the things you've listed as your experience, then they're going to be like, well, did you make this stuff up? Like, what? I mean, it doesn't set you apart, and you don't sound like you know what you're talking about. I mean, you can do an internship and have no clue what you did, or you can do an internship and you can know what you did, understand why it was important, and then be able to convey that to someone else. So the Career Center is also great for mock interviews, because that is really important. Coming from a person who sent out millions of resumes and cover letters when I was unemployed, and doing stuff like that, it really, really is important. So, I mean, just coming from that standpoint of having been there. And I know that when I got my teaching job at SCC, I had actually originally applied for a full-time position, and I was the runner-up only because the other person had like years more experience than me. But they literally, the head of the department called me up and said, your interview was amazing. the only reason we're hiring this other person is because of their extensive many more years than you of experience teaching. And I had to give like a teaching demonstration and everything. And so she said, you know, but if we have any type of adjunct work, I want to hire you. And so I kept my name on file, and the first adjunct position that came up, they called me. So, I mean, your interview skills really are important.
And I'd just like to add that when I applied for my NRCS job, I brought my cover letter and my KSA's knowledge, skills, and abilities to the Career Center and had them review it before I presented it. So don't forget about that.
Even as an alumni, we're here.
Yep, many years after I graduated.
I think it's also important to look for fit. I mean, you know what you need to feel good about what you're going to be doing every day. And at Bioscience, we hire for fit. We don't hire, we can teach you, if you're willing to learn and you've got a basic understanding of science and some of the techniques that we would use in a laboratory, we can teach you the rest. It's all about willingness to learn and understanding that in a new job, you're still going to be kind of a student. There are going to be people who are going to teach you things. Are you willing to do that, or do you have to, you know, kind of show what an expert you are right from day one? That doesn't fit in our culture. We're a very team-based culture, and so we're looking for people that have, you know, a certain level of drive, curiosity, a self-starter, somebody who can be articulate, who can demonstrate it both verbally and in a written form. And that really works well in our organization.
Just one follow-on there is, you heard mention of team behaviors. If you're involved in a team or a club of any type, that's something to call out, because what they teach you in college and through all of your education is to hide your work, don't let anybody copy. Well, as soon as you get into a company, you have to share, and the faster you can move and share information amongst the other individuals, the better off you are. So, you know, I find athletic training as a team member has been very beneficial to myself, but any of the clubs or anything where you share in the solution, that's a major difference between college and industrial work, is the ability to share and get your ideas across and not get defensive when your idea is not the solution. So, you know, think of that.
I feel so many questions out there. No question is a bad question. Do you want to know what I do with my day? Do you want to know why I cut my finger? Like, anything is...
What would you consider to be the most enjoyable aspect of your job?
Okay. So I am in research, right? So I'm not in industry. And I really enjoy the part of my job that allows me to follow the answers, which is probably why I'm still in academic research instead of industry. So, for example, I am right now working on a project where I'm collaborating with another lab, and we're using this fungus to infect mice. But up until this point, it's a fungus that affects you when you're severely immune compromised. So like you have AIDS, or you're having, you know, an organ transplant and you're on immunosuppressive drugs, or any number of other, you know, things that would cause you to be immunosuppressed. So your immune system is down, it's not fighting anything off. So we're trying to figure out right now how to make a better research model, because up until this point they've had to use basically a chemotherapy drug or a corticosteroid to get the mice infected, which those things basically take your immune system and blow it out of the water. So you just, nothing is there. And it's really hard to do immunology research on an infection when you don't have an immune system, right? So I'm working on that right now. And a big part of that for me is histology. And that's another career path you could go in besides being like a med tech or something. You could be a histotech. I do a ton of histology for my lab. And what that is, you know when you see the cover of Science or Nature and there's this really pretty picture of a cell and it's all fluorescent green and red and purple, or it's like pretty image of like someone's intestine or something like that. That's histology, and it is. I mean, that's what gets you cover of Nature and Science, is the pretty histology. hands down, every single time almost. And it's really cool because right now, like I take a lung out of a mouse and then that I've done stuff to, and I fix it and I process it and I embed it and I cut super, super thin sections. So like 5 microns thick, which is nothing, which is how I cut my finger on the blade, which is really sharp. And then, you know, I stain it for his hematoxylin and eosin, which can show me inflammation. It can show me what types of cells are there. It can show me morphology of the lung. And then I also do a silver staining for the fungus, because the fungus will turn brown and black if I stain with silver nitrate, and then I come back with gold chloride. And so it's kind of like you're the mad chemist, you know, in there figuring out what's going to give you the best picture. And the pictures are so beautiful. And I really love that part of my job. It's really rewarding because it's like visual and there's immediate feedback and you're not just looking at a graph or like some numbers. So that, and I enjoy the process too. I enjoy the whole process of going through that. So that is a big part of what I do in my job, and I really enjoy that. But I mean, I like the research part too, you know, like I got this cool result and oh my gosh, we've never seen that before. Holy crap, what's going on? Okay, well it could be this, or it could be that, or maybe it's this. So how do we go about figuring out how to narrow down which one it is? You know, I mean, it's completely stimulating all the time. I mean, you're always finding something new, or seeing something cool, or learning something new. And for me, I really like that because my job never gets old. You know, something new is always happening. We're always progressing to something else.
Anybody else want to share their favorite?
Well, mine is completely different. I work at the interface between engineering, business, and science. But since my career began, and for 20 years, it's when a difficult problem is solved, and it doesn't matter what level of employee, somebody who's just starting as an intern or somebody who's been there for 20 years, but they come running into your office with that piece of data that all of a sudden the whole puzzle comes together. I mean, there's just a fantastic feeling that occurs when that happens, and you never know where it's going to happen. You don't know which individual will come up with that, but somebody will find the key to the puzzle that you may have been working on for 2 years, and that's very rewarding. Good time to get a beer at that point.
I think it's kind of similar for me. It's problem solving that really is the most fun. So you're given a problem, whether it's a resource problem or how do you squeeze some information out of a data set, something like that, and then you sit down and step by step and work your way through that problem to a solution. Whether you're doing it alone or with somebody, it's always, you're faced with a challenge and then you work through it until you come up with a solution, and that is very satisfying.
For me, of course, I'm on a little bit different side of the business, so I've got all these people in the laboratory working with me and for me all the time, and I'm sort of managing the business. That's my job. Because after I got out of the sciences, I got my MBA, and so I'm playing on the business side a lot. But what is really exciting is to watch principal investigators help. A client comes in, they know what they want. I want to get this product to market. They have no idea how to do that. They have no idea how to test it. They have no idea what kind of results to look for. They don't have any idea how to set up a study. They're maybe in marketing or in some other aspect of business, and they've got this scientific thing that they want to do. And it's interesting to watch and invigorating to watch the principal investigators get together with their teams and really create the study. What materials do we need? How many plates are we going to need? How much broth are we going to need? How many people do we need in the lab? How many subjects do we need? How many sites are we going to have to test? What kind of statistics are we going to need to apply to that? And all of that, I'm going to call it scientific creativity, is really energizing. There's like this whole buzz in the room. And if PI over here hasn't been really familiar with this particular study so much, then PI over here comes and partners up, and then there's a whole new buzz going on. So it is that collaborative environment that I think is just so much fun to be part of. And a little bit of science background helps me at least speak their language.
Dr. Bloom, do you have a favorite part of your job?
Well, the favorite part of my job is really kind of different now than it was. I mean, I agree with the previous speakers who have talked about, the excitement of making some breakthrough and the tough work of getting that breakthrough to the point where, number one, you can publish it, and even beyond that, get it into the realm of public health where it might actually help somebody. And I think it's important to realize there's two kinds of research kind of, there's the eureka minute of, wow, I just found that. But there's a lot of it which is just a sort of incremental grinding away to get to that eureka moment. And it's very easy to be, I think, discouraged by the grinding away. But you always have to remember that there's going to be a eureka moment at some point along the line. And, that's just something that we all face. The things that I find real satisfying in what I do now is helping the younger investigators here this is something that you college students won't face for a while. You'll be at the other end of this, is people like me. I mean, my great satisfaction now comes from helping people your age or people who are new investigators or postdocs or post-baccalaureates, get where they want to go, and helping them get the resources and giving them the advice to how do I put this grant in, how am I going to, what's the best way to put these pictures together to make a convincing figure, do I have the argument in this discussion of my manuscript laid out well. So, I mean, I guess you guys should take solace in the fact that there are some of us older people who have sort of attained, senior positions and advisory positions, really do enjoy working with younger people and want to help them get where they are so that they can take over from us at some point in the future.
Thank you. Appreciate that. And we're glad that you're there helping the younger generation move in.